Hi, I'm Dr. Tara Lieberman from Hospice Care Network of Northwell Health. I'm here today to discuss the dying process and what to expect when your loved one is entering this phase. As we get to the end of our disease, the dying process is a normal process that we see that is just what happens at the end of life. And unfortunately, many of us do not experience this, and so I think it's important to recognize the signs and the symptoms so that they can be prepared and be understanding of what they are seeing and what they're experiencing with their loved one. So hospice is a insurance benefit that allows for a patient to be in their home at the end of life, mostly when we think that someone has less than 6 months to live. And it brings a team of professionals to your home to help support your loved one during their end-of-life care. As a patient is experiencing the dying phase, it's really important for family and their loved ones to be there to support them in a way that is meaningful, and to each patient that may be different. So what to expect at the end of life are things such as sleeping more, eating less, breathing may be irregular, sometimes fast, sometimes slow. You may hear sounds such as gurgling, and that may be because of the secretions that are in the person's mouth, but to be rest assured that the patient is not uncomfortable and that they are okay. And making sure that you are providing the right support at the bedside that may or may not be a lot of people depending on what the patient is needing at that time. And these are okay processes that we see, and it may not be linear, but you may see these symptoms occur at different stages of the dying process. We always say that you should call hospice when we think that someone has less than 6 months to live. What happens is it's tended to be called later, and we tend to take care of patients in those last few days of life, which is a benefit that is not being fully utilized. So we encourage people to refer earlier, so we are allowed to work as an interdisciplinary team to prepare everyone for those final days. I think it's important to have conversations with your family, your providers, about where the patient is in their disease process to understand the need for services such as hospice, and to initiate the conversation about when it would be appropriate, especially if one feels that they are getting sicker and need more support and care in their home.